Hi guys, today we're going to discuss the abdominal aorta. So let's get straight to the point. The abdominal aorta is the abdominal continuation of the thoracic aorta. And in order to reach the abdominal cavity, it needs to pass through the opening in the diaphragm. And this opening is called the aortic opening. Then it continues down along the spinal column, and around the level of L4, it splits into the major iliac blood vessels, and this split here, of course, is called a bifurcation, as per usual. Now, this blood vessel is located behind the peritoneum, so when you open your abdominal cavity, you won't see it straight away. You would see a bulge where the aorta should be, but that bulge would be basically the aorta with the peritoneal covering. The aorta itself has a lot of course, the abdominal aorta itself has a lot of blood vessels, a lot of branches starting from it. And these branches can be divided into several groups. First, based on their target, they can be either visceral for the organs or parietal for the wall, right? So the abdominal organs and the abdominal muscle walls would be supplied by these arteries. Now, a second option, or a second quality that you can quantify, you can group them by, is where they are going to branch from. One of them, you have three groups. One of them is called the anterior group, you have a lateral group, and you have a posterior group. And these are the regions along the circumference of the aorta that these arteries would arise from. So the anterior group, as the name implies, starts from the anterior wall in the midline. Since they're in the midline, they're only one of them. They can be only one of them, and they're also called unpaired. The lateral are not exactly on the lateral side, but more lateral to the midline, which you can see here. And these are usually paired arteries, one on each side, and you have the middle suprarenal artery, you have the renal artery, and you have the gonadal artery, like 4, 5, and 6. Now the gonadal artery, we say gonadal because it's in general, but of course in males it would be called the testicular artery, in females it would be called the ovarian artery. And in the last group we have the posterior group, which would arise from the back wall of the aorta. And these are the median sacral artery, the 4 lumbar arteries, and the phrenic arteries. Now for those three guys here, we'll have a separate video because it's will get kind of heavy for all the information for one video. If you prefer to have those everything bunched them into one segment, just tell me in the comments so I can make longer videos, or if you prefer these shorter format videos that you have them separated by topics, again, put it down in the comments. But let's start with the lateral group for now. The first one I have written here is the middle suprarenal artery. Now, if you have middle one, you probably have others, right? So the middle is the lateral branch, but you can see that I have 2 asterisks here. One for an artery starting from the renal artery, and one is with a branch arising from the phrenic artery. Those are the origins of the superior and inferior suprarenal artery, right? This with the inferior and this with the superior suprarenal. Those 4 guys would supply the suprarenal glands or the adrenal glands. The renal artery, again, is the biggest lateral branch that you're going to see, and the name, I suppose, is quite indicative of the function. But I just want to mention one thing. Now, imagine you have 2 kidneys. The kidneys are divided into 5 big segments. And these are the apical segments, superior and inferior segments. In between them, you have the middle segments. Middle segment, if you take this kidney and flip it around, on the other side, on the back of it, will be the posterior segment. And this is how usually the renal artery would branch. One going behind the pelvis of the kidney, and you have 4 branches coming in front of the pelvis, splitting into 3 for the into 4 for the 4 segments. This has a lot of variations in it. The 2 most common are you can get the apical segment splitting like that, or the inferior segment splitting like so. So they split from the renal artery itself, or they can originate from the abdominal aorta itself. You can have multiple renal arteries arising from them from different segments, so you have a lot of variations. But this one that I've pointed out here is the more important one, because usually this one is found, it can be front or behind, but it's found around the pielo-uretral junction. This is the junction between the renal pelvis and the ureter. And when this guy is present at this level, what usually happens is that it can compress, right? It can compress the junction, and that would impede the urine outflow. And when that happens, usually you get a condition which is called hydronephrosis, where this part kind of grows larger because of urine retention, and that can lead to a lot of unwanted things. Either way, the condition is known as aberrant renal artery hydronephrosis. So these are the renal arteries. The gonadal arteries we discussed, just for the testes or for the ovaries, nothing that hard there or something very interesting that we need to explain. The inferior phrenic artery, again, these are the posterior guys, 2 of them, and all of them would split into ascending and descending branches. One going behind, and the other going the vena cava or the esophagus, and the other going down towards the back wall. Now, these ascending and descending branches would split further into smaller branches, into smaller arteries, but this is not very important to be honest, so we're going to omit that information. The medial sacral artery is a one that's basically an unpaired branch of the posterior group, which is kind of the exception. This is the only unpaired artery apart from this group here. It starts behind and goes straight down, straight at the midline, and you can find it usually over the sacrum, in the middle of the sacrum. Hence, median sacral artery. It's not that important usually from this guy. Sometimes you can see lumbar arteries originating from them, like a 5th lumbar artery if it's present, and it very often makes anastomosis with other arteries, which are called the lateral sacral arteries, which will start from here usually like that, from the iliac vessels, but I am not going to discuss them now because this is not part of the abdominal aorta. We'll have a separate video, of course, for the common iliac arteries if you think it's going to be useful. So again, comment down. The interesting one that from this group I want to discuss are the lumbar arteries, and you will see why in a second. Now, what I have done here is I have taken one lumbar artery and have enlarged it a bit. Why? On your dissections, when you remove the peritoneum, you're going to see several small arteries here, 4 of them, lying over the vertebra at L4 to L1, and very soon you're going to lose track of them. Why? Because these lumbar arteries, they usually sleep underneath the psoas major and the quadratus lumborum muscle, so they are located behind these muscles. The psoas major starts from the bodies and forms these tendinous arches, right, like that, and the lumbar artery just kind of goes straight into them. So if you want to see them, you usually have to dissect the psoas major muscle, at which point you usually destroy the lumbar artery so you don't get to see them either way. But if you're very careful and you dissect very nicely, that's what you're going to see. You're going to see one long artery that continues like that, gives a lot of branches, continues laterally, and then slips pierces transverse muscle and slips underneath. This branch that goes through the transverse abdominal muscle from the lateral abdominal muscles is known as the lateral branch. And it would run in between the two muscles, and it would give at some point these piercing branches or perforating branches that would pierce the internal oblique and eventually the external oblique muscle and would reach the skin. So the point of this lateral branch is to supply the lateral abdominal muscles and the skin around this area, and eventually this guy would reach the center and would anastomose with sorry, I forgot the name, escapes me, but the inferior epigastric artery, exactly, and this inferior epigastric artery input helps supply the rectus abdominis. Okay, so there are two more branches here that arise from this artery. One goes straight back, and it's known as the dorsal branch, and it splits into medial and lateral cutaneous branches. This guy would supply the back muscles, which are near the vertebral, the spinal column, and the skin around that area. And the interesting one is called the medial branch. Now, as you can see, I made a mistake here, but basically this was the last thing I wrote, but I'm not going to redraw everything. So sorry, we will have to just accept it. So the medial branch. The medial branch splits again into two. And this medial branch is also known as the spinal branch. Why? Because this guy supplies the spinal cord. It starts from the lumbar artery, but then it goes back. It loops back towards the midline. That's what's called the medial branch. And it splits into arteries, which are called the radicular arteries. And let's say if the pencil is the spinal cord, they would go through the intervertebral foramens and would loop around the spinal cord like that, behind and in front. And that's with the anterior and posterior radicular arteries. And they're quite important, especially for the lower segments. Something interesting that I want to mention here is that you have an artery which is called the major radicular artery, or the major anterior radicular artery. And this is a very big anterior branch which arises usually somewhere in the levels T9 to L2. And it's quite important because it supplies a lot of the blood for the lower 2/3 or third, depending on the level of the spinal cord. And damage to this artery, regardless if it's due to some, I don't know, trauma or most often during surgery, would take well out of the blood supply for the lower spinal cord, which usually sadly results into an ischemic condition and into a paralysis for your patient. The name of this artery is also known as the Adamkiewicz artery. If I'm mispronouncing that, sorry. Personally, I prefer the major radicular artery, or arteria radicularis magna, because this gives you an explanation of what the artery is, right? It's the biggest radicular artery, so the name implies the function. But you'll hear this one more often said. Okay. And pretty much those are most of the, just one more thing. You do have a communicating branch which arises from a little bit before this one, from the lumbar artery, and it would connect with the lower one. So at L2 you have one connecting to L3, from L1 to L2, and basically it would look like one long strand which interconnects the 4 lumbar arteries. And this is the so-called communicating branch. Okay, so these are the major things that you should keep in mind for the abdominal aorta. I just remembered something that I want to mention in the clinic, since we were talking for some clinical pointers. If you see the renal artery and make a line the renal artery, that would divide the abdominal aorta into suprarenal and infrarenal portions, and this is a way but the clinicians divide this one, mainly because of something that's called aortic aneurysms, it turns out that like 80% of those abdominal aortic aneurysms happen in the infrarenal portion, and there is different way you can put. There's different ways you can operate that aneurysm. So that's quite important for this division is quite important for surgical intervention from the clinical point of view. Okay, so that's pretty much it. Thanks for listening. I hope it was short and insightful. If you want more videos like this one, comment down. If you prefer different format of video, again, just let me know what you want. So have a nice day and enjoy the rest of your whatever day or evening you have.